Good afternoon, everybody, and welcome to my second series webinar. Just like to welcome all of you new patients who are here. It's really nice to welcome you to the Riverbanks family. We're all very friendly as the team and all of our patients. And if there's any questions you would like to ask, please pop them on the Q&A section, which should be at the top or bottom of your screen. And I'll be able to address those for you. Thanks for filling the poll. There'll be one or two more polls later on. And the reason for those polls is to try to identify really how I can communicate with you better and really address topics that you're interested in. So what came up with in one of my newsletters last year was, again, we really ask our patients what they would like me to talk about and share with them. And last week we talked about how to rejuvenate eyes. We had a fantastic response to that last week. Lots of questions and quite a few online consultations on the back of that. Now, the next most popular request was, how do we treat jowls? And probably that's the most, in my clinical practice, that's what we hear the most, is how do we treat jowls? So that's what I'm going to share with you, how I treat jowls in my practice. Now, for those of you who don't know me, my background is in NHS general practice, but I've been a consultant aesthetic physician since 2006. And what does that mean? Well, that means really, I really take a lot of time. I've done a lot of research, a lot of education, and also I'm privileged enough to be considered an educator to over 20,000 healthcare professionals globally in over 25 countries because of my really my honest approach and expert approach to facial aesthetics. I always put my patients' interests as the most important matter on every single encounter with them, and everything I do is for your interests. It's really how medicine is practiced and how I believe it should be practiced, and I convey those principles across to you. So you can always consider me and my team as your approachable aesthetics expert. My team is based here at Riverbanks Wellness. We're just outside Harpenden. We've won about 4 awards on best clinic in the country since 2009. We've, as I said, our values are based on the principles of good medical practice, safety, honesty, integrity, and your best interests are our priority. So let's just talk about why we're here. And here we are, we have a jowl. What we also have here is that we have a lot of excess skin. And what we also have here is a lot of significant sun damage, you can see, which is taking the elasticity away from the skin and making this really a very difficult patient to treat. She is not ideal for non-surgical treatments if she's expecting a tight jawline and a tight neck. She does require surgical solution, as in a facelift. So if any of you do have this appearance now, really my advice to you is to seek the advice of a plastic surgeon who specializes in face and neck lifts. Now, contrary to what it may seem, there's not too many out there in the country, and there's only a few who are doing at least 2 or 3 a week. Really, always ping me an email if you want to know who should go and see. There's 2 or 3 consultants who I recommend wholeheartedly. However, most of my patients are not to that degree. And so what I'm going to do first is share with you my experiences and my expertise and my knowledge on what I believe causes the jowls. And really, there are 4 main considerations we have to look at. First of all, if we look at the difference in these women, this schematic between the 20s, 30s and beyond, is that there's a significant difference in the tension of the skin. And it's not just the skin that tension that's important, it's also the muscular tension underneath the skin that's holding the structures up, that moves, but also the tendons and the ligaments. And the ligaments are there which really attach the bone to the overlying structures, such as the skin, the fat pad, and muscles. So tension is one key area that I have to consider. Next thing is laxity. In other words, how much sun damage is there? How much hanging of the skin is there? Is there excess skin required? And as we can see, as we get older, that changes as well. The other thing is shrinkage. Shrinkage of what, you may ask? Well, there's shrinkage of the skull. And those of you that attended last week's webinar on rejuvenating eyes may remember that I talked about how the skull changes. Well, the skull changes in several ways. Some parts of it retract, such as the mid-face and perhaps above the top part of the teeth, so the maxilla, and around the temples. The skull tends to shrink and go inwards. And other areas, you may get some growth, such as the chin, and also you might get some fat pad growth and some fat pad shrinkage. So all of these I have to consider as when I'm planning the best approach and the best solution for you, because I'm sure you would like the best solution. Many people are fearful that the best solution may be the most expensive. Well, let me tell you with my experience that often it is a combination and repeated worst solutions or inadequate solutions that end up being much more expensive than trying to get to the best solution first. I showed you this image last week when we talked about rejuvenating eyes, and we saw how the eye socket enlarged. And again, here we'll see the starting of the jowl formation. But what you'll also notice that the skin quality has deteriorated considerably, with a lot of fine lines developing in the lower face around the mouth, as well as pigmentation, as well as generally a downward trend of skin creases. And again, this is caused by the features I mentioned before. If we look at this in a bit more detail, a youthful face generally has that nice plump look because it's got very good volumes of fat. The fat cells in the fat pads in the face are nicely hydrated, they're healthy, and they give a glow to your skin. As we get older, fat pads reduce in size and health and hydration. And as a result, the skin tends to deplete as well. But this picture isn't entirely accurate about what goes on, because what happens often is that the ligaments supporting these fat pads tends to cause these fat pads to drop as well. So this is an exaggeration. What tends to happen in reality, there's a thinning of the fat pads and a falling of the fat pads. They tend to slip down the face, and we need to reposition those back up. Let's look at the skull and the muscle. So remember last week I talked to you about how the eye socket became squarer and wider, and that's why we've got deep and hollowed eyes. The same thing here, really. Look at the jawline. We see that the jaw is thinner, and also and it's lost volume. So there's greater hollowness between the upper jaw and the lower jaw. And also the muscles are thinner, and all of these contribute to a sagging face. This is a bit of a depressing shot here. We'll see an X-ray of a radiological image of a skull and a female. Nice tight angle of jaw. Look what happens as we get older. It seems to just slide forward. It's like a landslide. The angle of the jaw has become more obtuse, and also the chin's protruded further. And all this does is give rise to a much more of an older appearance and jowl formation. So just before I go to the next section, I'm going to go for my next poll, which will be, I just want to ask you quickly, if any of you are using any social media, if you could help me out by just responding to this poll. It will take 2 minutes, and I'll head on to the next section. Right. I'll get a bit of a drink. If you've got any questions in the meanwhile, I'll answer them as well. There's one question here. Do facial exercises help with jowls? To a degree, yes, absolutely. I mean, you use any muscle properly and effectively and regularly, it's going to be tighter and it's going to be tighter and bulkier, and therefore give volume and serve its function. Unfortunately, by the time people come to see me, the facial exercises, they've gone beyond facial exercise, or they've never done facial exercise before, and they're not prepared to put in the effort. By the time you've got jowls, which I can grab with my hands, like pinch like this, there's probably an element of skin laxity, ligament atrophy, so that's thinning of the ligaments, as well as some fatty atrophy and some slip. They're going to require a bit more than facial exercises. The principles of Casey are based upon facial exercise muscle stimulation, so electromagnetic muscle stimulation, and those help to a degree. So they're good to do when you're young and you haven't got too much jowl formation. Once the jowls have started and they're significant and noticeable, I do believe that some more medical intervention is required. Okay, thank you very much for filling this out. I'll end that. And we'll go on to the next slide. So let's start at the beginning. I remember I talked to you about tension. Well, let's look at muscles that pull the jowls. So many of you, I don't know if you ever noticed these are called platysmal bands, these turkey bands, some people call them. And if you look at where they're attached along the jaw, okay? And they actually overlap the jaw to about halfway up the face here. But where they cross the jaw, this is where the jowl tends to sit. And in some people, this lady's flexing, tensing her muscles on purpose, but in some people, the jowl is formed by an increased resting tone of this platysmal muscle. So if the jawline is blurred when we express like this, the good treatment in the first instance may be using botulinum toxin to relax those muscles, much as we do in the same way in the upper face where we try to relax unwanted and excessive expressions. And in those patients where the jowl is caused by this excessive pull of the neck muscle, you can get quite remarkable results relatively simply within 1 or 2 weeks, no downtime, less than 5-minute injection procedure, and it lasts about 4 months. And this is called, it was called the Nefertiti lift. It's first described by a friend of mine, Philip Levy, who's a Canadian dermatologist, now based out of Switzerland, and he coined this first. And we've tried, and it's been very remarkable. If we look at this lady here, there's very little distinction between her face and her neck, all right? And this is what we identified, that there was a significant muscle contraction going on here. And this is in my clinic room. You can recognize the fridge perhaps on my little notepad, recording the fridge temperatures. Okay, so I injected some botulinum toxin into the muscles, the appropriate muscles. This is the masseter muscle here, and this is the platysmal muscle here. And what you'll see with her arrest 4 weeks later, a significant improvement in her jawline with botulinum toxin injections. So very, very pleasing, very, very simple, but it's so critical. We have to choose the right patients here. It's not for everyone. So you have to repeat that treatment every 3 to 4 months, and each treatment is about £450. The next option is where there's volume loss caused by a thinning of the bone or thinning of the muscles or thinning of the fatty pads in the face. And this is my R-lift, which we've patented a few years ago, and we've taught in numerous countries all around the world now. And the aim here, if we look at this lady, she's got a loss of volume above her eyebrow. You can see the temple's starting to hollow out, mainly because you're starting to see a ridging of her upper eye socket. All right, this is hollowing, very aging feature. We're also seeing a slight jowling formation starting. And this is caused primarily because of a flattening of the fat pads in her malar zone. So this is the cheek zone, mid-face zone. What I'm going to do here, is I use dermal fillers such as Restylane, such as Ivoire, such as Elance to restore this volume, and I inject underneath the important tissues, not under the skin, underneath the muscles, into the fat pads, on top of the bone, okay? Sounds ghastly, it's not bad at all, in what is a 30-minute appointment for most people. And we tend to get very pleasing results. And what you'll see here, in this case, I've managed to do with 2 injection points, one on the cheekbone, on the zygoma, and one on the jawline, just in front of the jowl. And I use a cannula. And at first I'll inject under the temple area, and then I'll inject using the cannula is about this long, it's about 5 centimeters long, and we'll inject really into the fat pads that have depleted, and again here to the chin area and behind the jowl. I don't inject into the jowl because that will make it bigger. I also place some tiny deposits next to the nose and into the mid cheek here deeper to give the lift. And what you see here This is an instant result, okay? Absolutely 5 minutes after her procedure, and you'll see a much more pleasing outcome. Jawline's not perfect, but it's a lot better. And this will last, again, 9 months in the first instance, and then repeated treatments need to be about every 12 to 15 months. Most patients, such as this lady here, will cost about £1,000 each treatment, but for others where they have required more volume, it could go up to £2,000 of treatment. I'll just see if there's any questions. I'm afraid I'm not fully aware what new face is, so I won't be able to answer that question live, but I'll look it up for you and maybe come back to you. Right. Again, this is another example of using some tissue fillers. In this instance, it was Sculptra, significant hollowing of the face caused by significant weight loss. What we see here is a really, and this was the really, she doesn't have laxity per se, she just has significant hollowing. So by restoring the volume in this patient, we achieved a very pleasing outcome, and this will last about 12 to 15 months. Again, the spend here was about £2,500, and she'll need to probably maintain that by spending half as much on an annual basis. Now, the next treatment is something that's a bit more long lasting. It's the infinite thread lift, or the infinite lift we're calling it now. And typically what I'm going to do is I'm going to lift up those fat pads that have fallen, support those ligaments that have stretched and slid down the face, and I'm going to hook up those jowls and lift them up into 3 needle entry points in your hairline, and this is a permanent outcome. Right? These stitches, or threads as you choose to call them, are injected under local anesthetic. The procedure of placing the threads lasts about 60 minutes, but you're in the clinic for about 3 hours in total, because we have to plan and mark up and prep you. And you will require about 3 to 7 days downtime. This is lasting in most patients about 5 years. The reason I say still counting is because this particular version of the treatment has only been about 5 years old, and no repeat procedures have been done yet to date. Some patients have required extra threads, because maybe 1 or 2 threads, because they've either gained weight or they want more of a lift. But overall, this is a once in every few years treatment. We've got a separate webinar on that online already, if someone wants to watch that in more detail. Cost of this is £4,000 onwards, and really what you're getting here is convenience of having a one treatment, no repeated need for additional fillers or regular visits to me once you've got over the recovery period, and actually a treatment which addresses the true cause of the jowl formation rather than trying to temporarily mask it. This is the future of facelift surgeries, because it's minimally invasive. We don't actually use a scalpel in the procedure, and here you can see some very pleasing outcome results in a 50-year-old lady. What we see here is there's laxity, there's volume loss in the mid-face, as well as the neck and the marionettes. So if you look at if you looked at this picture alone, most people would think she's had lots of filler put in her face. She's had no filler at all. This is just repositioning the fat pads that have fallen and slid down her face, repositioning them into the correct position where they were when she was in her 20s. So these are the effects of the infinite thread lift so far. And finally, what I've got here as a final treatment on its own is radio frequency treatments. Now, the E-lift, what's great about the E-lift, it's for patients that really don't want any needles, don't want any product put in their skin, don't want any downtime, don't want any pain, and really cannot afford a bruise or any risk of downtime. Well then, Please understand your expectations have to be set a lot lower than with a more of an interventional treatment, okay, a more invasive treatment. There is no downtime with radiofrequency treatments. The radiofrequency is delivered onto the face via a hot probe. We want your skin surface temperature to reach about 40 to 42 degrees. That means the deeper tissues will be at about 60 degrees. That's quite warm. And what happens at that temperature is that we get a remodeling of the collagen fibers under the skin. So if we look here, this is before treatment. There's a few wrinkles on the surface of the skin. There's not too much collagen because we've got to that age where we start losing it and don't reproduce it as much. By heating the tissues to that temperature, it stimulates a wound response, which stimulates more collagen growth. And as a result, you get a much better foundation under the skin, more densely packed collagen, and therefore more hydration and more supported skin, and you get a smoother, tighter skin surface. To get these results, you need to have more free treatments. So initially, you need to have 6 to 8 treatments on a weekly basis or fortnightly at most. And then we recommend at least 12 treatments a year in total. So this requires a regular maintenance. But the beauty is there's no downtime. I must hasten to say that if you've had an infinite lift, energy-based treatments such as the e-lift are contraindicated. Your options there are to have a further thread or put in if you want more lifting or to improve the skin quality. These are the sorts of results you can get with the e-lift. So again, not as dramatic as the thread or the filler, but still a brightening of the skin and some degree of lifting, despite the fact she doesn't look that happy. Right. Oh, I'm sorry. Let's go back. Sorry, I've got a bit of a technical issue there. I'm just going to find my presentation again, and I'll come back to you very shortly, and I'll try and answer something. Here we are. Great. So cost of the e-lift is about £1,200 a year. We have a great package for that to encourage people to get onto the program with e-lift and maintain their skin on a regular basis. Now, what I've done, I've spoken to you all. Are we sharing this, by the way? I've lost thread here. Yeah. Sorry, I am. There we are. So we're sharing again. Sorry, got me now. So I've spoken to you about individual treatments. The important thing but I also mentioned right at the beginning, there are multiple causes to jowl formation and most of the features that people are concerned about with aging. So it may be you need a combination of botulinum toxin, dermal fillers, and Exilis. Maybe you'll need a thread lift with some botulinum toxin to lift the brows, to address those platysmal bands, and you might need some fillers where the threads don't work, such as the temple area. Okay, it's so important to appreciate that non-surgical aesthetics, or even surgical aesthetics, when we want to get the most natural looking and longer lasting results and the highest degree of your satisfaction, it's important to consider and to take part in combination treatments. The other thing we mustn't forget is your quality of your skin. If your skin is covered in hyperpigmentation, sunspots, there's lots of fine lines and wrinkles on the surface of the skin, it's dull looking, it's a bit grey, and we lift you, it's not going to look right. If you've got the shape of someone who's in their 30s or 40s, and you've got the skin of someone who in their 70s or 80s, again, that's going to create a mismatch, and people will go, something's not quite right there. If you improve the quality of your skin, and this may need lasers, such as the core laser, fractional surface laser, V-beam laser for rosacea, intense pulse light, or it may need a skin peel, such as the dermamelan, or skin boosters, such as Restylane skin boosters, or the amazing Profilo. By combining all of these treatments, with you, you will get the most natural looking outcome. And you know what? You'll be even happier than if you did it alone. I'm just going to share with you this lady who came to see me in 2008, I think. Yes, 2008. And you can see her, she wasn't particularly happy. Her skin was not very vibrant. There's a lot of wrinkling, loss of volume. And she ended up becoming one of my most loyal and customers before she emigrated. She has had a combination of radiofrequency, regular skin treatments, skin peels, dermal fillers, CO2 laser, and botulinum toxin, literally a combination over the years. And if we look at how she developed over 8 years later, sure, she's got a little bit of acne here and a little bit of redness still. But what we're seeing here is that you would have thought that this would be the other way round, that this would be her before photo and this would be her 8 years later with no treatment. And what we see, she's even had her lips done, and what you can see is a natural outline to her lips as well. So this demonstrates to me the successes of combination treatments. And so please do consider that when we're planning your jowl treatment. Just to give you an idea of how much does all of this cost, well, the recent studies audit launched by the British Association of Plastic Surgeons in 2019 showed that facelifts were actually the 7th most popular treatment out of the top 10 in all of the surgeries plastic surgeons do. So that just brings me back to that point I mentioned right at the beginning. There are not many plastic surgeons that are doing facelifts on a weekly basis anymore. Okay, so and the reason for that is because the treatments offered by what I've just explained to you really are addressing a lot of patients' concerns. But more importantly, there is very little downtime with the treatments I've offered you and explained to you, and they're much safer. There's virtually zero risk of nerve damage, zero risk of any other significant scarring or any other health issues. It might be that in the first year or two, you seem to invest the most in a treatment in your appearance, and then afterwards the maintenance is less. That's not uncommon at all. But if you're considering the full face considerations to give yourself the most natural look, we found that the highest patient satisfaction is when patients tend to invest the most in the first 2 or 3 years of their aesthetic journey, and then afterwards you find that the maintenance is much less. So please remember that surgery doesn't address everything, doesn't tend to address skin quality, doesn't address the needs for what Botox can do. And surgery doesn't last forever either. You will need to repeat it at some point. That goes for every single aspect of cosmetic surgery. So please consider that as well. So just to summarize, before I answer, actually what I'll do, I'll go some of the questions now. And I'm afraid I'm going to have to put on my glasses to do that. So the fillers we used are a combination of hyaluronic acid fillers, Restylane, or Hivoire. The infinite thread lift is, many people ask me how much lift of the eye can you get. The infinite thread lift is designed to treat jowls and mid-face. Okay, any lift you get around the eye is a added bonus. So please, if you're considering if you want the infinite thread lift, but you just want it for your eyes, that's not the right treatment for you. The E-lift is not the same as collagen wave. It uses a radio frequency system called Exilis. They're all slightly different. But at the end of the day, as long as you heat the tissue enough, you will get some response. Good question is the E-lift the same as HIFU? No. HIFU is high intensity focused ultrasound. So we have the original at the practice called Ultherapy. One of the reasons I didn't list Ultherapy as an option is because for the same amount of money, I think you can get a much better outcome with dermal fillers or with the infinite thread lift. I just feel that it's a treatment that we find we have better alternatives for. Okay. And someone's asked, what's the best procedure for the over 60s? Well, really, it just depends on what your skin's doing, what your laxity is, and also, so everyone's different. I've seen 40-year-olds with skin which is what I'd have thought should be 60, 70-year-olds. And I've seen 60-year-olds with skin that's as good as a 30-year-old. So I can't really answer that question for you. And unfortunately, I don't believe Exilis will offer any solution to upper lip lines. That's going to be a combination of fractional lasers and some very careful use of skin boosters. Right, now, that's all the questions. All right, there's a few more here. If you were to have the infinite thread lift, will you have to avoid microneedling and radiofrequency? You wouldn't have to avoid microneedling, but radiofrequency treatments, yes, because we're concerned that they could affect the integrity of the threads. And a thread lift is done via, it's really just a matter of passing a thread under the skin with a cannula, similar to how I place fillers. Regarding the infinite thread, what I suggest a lot of people do, could they refer to my webinar on the infinite thread lift, which is available on YouTube? If you just search for the infinite thread lift webinar by Dr. Ravi Jain, there'll be a whole session there. All right, so before I close now, I just want to summarize. Not one single treatment fixes everything. I have 4 different options for you. There's the E-lift, which is a radiofrequency based treatment with no downtime, no needles and no bruising. It requires more maintenance, and you tend to have more of a lower degree of expectation. The Nefertiti lift, which uses botulinum toxin, which is for a select few patients who have a muscular cause to their jowl. There's the R-lift, where I use dermal fillers to restore lost volume and give people an immediate lift, which lasts about 12 months on average. And then we've got the infinite lift, which is a permanent suspension thread lift. It's an alternative to facelift surgery, giving results very similar to facelift surgery, but with very, very little downtime compared to facelift surgery. And please don't forget your skin quality. So what can you all do next? Following the last webinar, we got a lot of demand for further questions and an online consultations. What you can do is please download our app, which can be found in the App Store or on our Riverbanks webpage, and look for the Riverbanks Wellness app. And you can, if you haven't already, please register and book an online consultation with me. These are complimentary. Okay, there, ask as many questions as you want about your concerns, and we can formulate a plan together where we can really decide a plan for you to address your concerns, your lifestyle, and what your goals are. And also to fit in with your budget, which you have in mind. Next, I'm going to, after this webinar, maybe today, tomorrow, I'm going to send you a survey, and I'd really like your feedback on what you thought about the webinar, and really to see what else you'd like to hear about. And finally, next week, please join me for one of the most popular treatments of 2020, which was a double chin reduction. So next week, I'm going to explain to you how I can get rid of any double chins, the Zoom double chin, in my webinar next week, which will be at a similar time. Thank you very much, everybody, and I will speak to you soon. Take care. Bye-bye.